Hello, I'm Governor Brian Sandoval. Nevada loses 1 citizen per day to opioid overdose. This is completely unacceptable to me and to Nevada. Thanks to the hard work, dedication, and compassion of healthcare professionals and engaged citizens across our great state, Nevada has and continues to aggressively combat this terrible addiction. Over the course of the next 30 minutes, you will hear from some of our fellow Nevadans who have experienced the scourge of this epidemic. I hope that through hearing their stories and learning about the ways you can get help, you will see firsthand how Nevada provides the critical resources necessary to combat this disease in our communities. I encourage you to educate yourself on this issue, be engaged, and ask questions when talking with your doctor. If you're concerned for yourself or a loved one, please seek help immediately. For more information, go to healthierNV.org.
If I had known what was coming, I would have never asked her to move out.
Screaming, "Please, save my daddy. Please, don't let him die."
It's like a bomb going off in your family.
There's nothing you could have said, because nobody could have said anything to me.
It affects everyone in that person's life.
This is a disease. It's an epidemic. I can leave here and come back in 10 minutes and have opioids in my pocket. It's that big.
I should either be dead or locked away in prison.
Opioid epidemic is getting worse. 4 out of 5 heroin users start with prescription pills. Opioid epidemic, a public health emergency.
I was a big football fan, and my favorite player was Bubba Smith for the Baltimore Colts. And I told Cindy, if we ever have a son, I'm going to call him Bubba. Eventually, Bub just stuck, and he was known as Bub forever, all the way through high school and college. He was a boy that every father wants, and I'm glad he was mine. Michael Edward Yannick. He worked so hard, even during grade school. He'd come home from football practice and he'd go shoot baskets as soon as he got home.
His aspiration was always to play at a higher level. So he did get recruited all over the country, but I knew in his heart he was going to stay home. He was more my homebody, where my girls more independent and they were traveling here and there. Bub loved home and he loved family.
He and I in particular were really close our whole life. Bub was the kid that cared for the other kid that was getting bullied. You know, he'd take him in under his wing when it wasn't cool.
I really loved watching him because he was a leader and a captain, and he had a big personality both on the field and off the field. So that translated into our family and every other possible life he touched.
He was a sophomore up at the university, and he hurt his knee and had to have it surgically repaired. And this is where he got introduced to pain-killing prescription drugs by a doctor.
He would come over for dinners, and sometimes, he'd be really profusely sweating, and I'd ask him if he was okay.
Somewhere unbeknownst to us, he developed a substance use disorder.
And him and I were extremely close, very, very, very close. He used to tell me everything, but he didn't so much tell me a lot about that. We had no idea how addictive they were.
It manifested itself to a point where he came in and asked for us to help him.
We sat in this living room when he was detoxing, and he was suffering. And he went through it over and over and over again. It's the most powerful substance in the world. There is nothing more addicting.
I was young, but I knew what was going on. And it changes a person.
We were so naive and unaware of how powerful pain-killing prescription drugs are.
And he didn't want to do that to us. I know he didn't. And my mom and dad never gave up on him. They just kept fighting for his life.
Addiction was the most challenging thing we've ever all faced.
And that's why it's so devastating, because it affects everybody in that family.
Many people believe that it's a character flaw. It's a brain disease. And we have since learned that after between 2 and 4 doses of an opioid pain-killing prescription drug, you can become addicted. It changes the brain that quickly. It's that powerful. Of course, we didn't know that at the time. My wife and I were getting ready to go out of town, and I was packing up, and he asked me if he could help. But the last words I heard him say was, "Dad, can I go get you and Mom bagels?" I gotta take a minute.
I miss everything about it.
We just did everything together for our whole lives. Yeah, imagine losing your best friend.
I used to tease him and tell him I would never get a tattoo because I would always get tired of it. It'd have to have meaning to me.
Forever, bub. My life's changed forever. And he would want us to help other people struggling like he did.
Bub's death is really, it's inspiring us to keep fighting the fight, to not give up, to never give up.
The stigma with addiction keeps those with the addiction embarrassed, not wanting to reach out to get help.
And we're going to support those who are addicted because they're worth it.
And I think if we all came together, I think they have a chance. I think there's so much hope out there.
Opioid overdose is a mother's nightmare. Everybody kind of has this image of what an addicted person looks like. It's not that way anymore. It's not the person that's living down by the river. It's not the person that's on the street corner begging for money. It's our kids.
The opioid epidemic has been considered a public health crisis nationwide. The state of Nevada is actively working with partners, community stakeholders, medical providers, and patients to join together to increase our efforts related to prevention, early intervention, and treatment for individuals who need help. We certainly encourage patients to start the conversation with their prescribers. Having a conversation around the risks and benefits of the medication can certainly help individuals make informed decisions about the medications that they choose to take.
Opioid addiction affects everyone. It does not discriminate race, creed, color, religion, political affiliation, socioeconomic status. No one is impervious to opioid addiction. and you have no idea what your body is going to do when you put that drug into your system.
When you're in Lyon County, any one of my communities, whether it's Fernley or Dayton or down here in Yerington, neighbors know each other.
I mean, I'm pretty sure, we had just as normal of a childhood as you could ask for. As a triathlete in high school with an advanced honors diploma.
Just enjoying childhood and in a safe place. And as a parent, you're constantly trying to watch those. Is it that kid that you're not supposed to get around? But you're not there every moment. You cannot live their life every moment and see what's going on. And unfortunately, and sadly, my daughter started down the wrong road.
I got pregnant with my daughter Megan right out of high school. She was happy and healthy and everything was great. February 24th of 2010, she passed away from SIDS, and shortly afterwards, I kind of lost my mind.
I think the death of her child really started that cycle downhill, and she started turning to things to numb the pain.
People would see me, just totally trashed, and they would say, like, man, that girl's really messed up. And people were like, don't you know what happened to her? And then after so many years, it was like I adapted that thought process to where it was like, people would be like, man, Sabrina, you're really messed up. And I'm like, don't you know what happened to me? Shut up. Out of the blue, in 2013, I got pregnant, and I was pregnant with twins. I had stopped using, and things got really good. And shortly after I gave birth to the twins, their dad started using, and I was upset, so I started using again too.
All of those that haven't gone down the road of the addict, they're not bad people. They just make bad choices.
It's not pretty and it's not fun. And people don't understand how quickly your body becomes saturated with the opiates and how quickly your mind says you need that.
As a parent, watching your child just self-destruct is just, and being helpless is overwhelming.
That's when they removed the twins from me.
DCFS had to go through the right protocols, and they gave them to the biological father. And he was an addict. We got a call from a neighbor of neglect. And we got the twins that night. They were pretty much just left in a playpen. That's it. Left in a playpen to fend for themselves. They couldn't get out. The most wrenching thing for me at that point in time was when we fed them, they fought over food because they weren't being fed.
When I was in jail, I actually wrote a letter to my dad and pretty much just said that I just couldn't understand how I couldn't get it right.
My daughter really, really struggled. I probably was standing right about here. She's either sitting down or down on the floor or sitting on the bench. And when I just told her, you turned your back on your children for drugs. And I turned around and walked out. And that was it.
March 15th, I woke up on the booking room floor, and I've been sober ever since.
You have to be patient. You can't just throw them away. You can't discard them. There's going to be a moment. And you got that one split second, and you better be ready.
They had the twins for almost 11 months before, I finally got it together. And if I didn't have my mom and my dad, I don't know where I would be.
Family is everything to me. I'll do anything for my family.
He's like the iconic American image of like what a really good person and a good man should be.
You take this job because you want to make a difference. You want your children to grow up in a community that values life and values community. So about a year ago, we got a call for an individual up here overdosed on bad drug. Across here, we've done drug busts in these houses over here. The house to my right here, we had an overdose of opioids, 43 years old. And an addict is not a criminal. An addict is somebody that's lost their way. And as I've said many times, we can't prosecute our way out of this mess. We have to find other solutions.
I grew up on the reservation and here in Yerington. I don't know, I try not to glamorize my childhood because I've never been through nothing like stressful in my life. It's just like when my dad left, that's when things started getting bad for me. I started drinking when I was 13, exactly the time when he left, and drinking turned into smoking weed. Since I was 13 to 17, that's when I started popping pills. I have a problem. I have a drug addiction. I have an alcohol problem too. I was 4 months clean and went to rehab. Their dad just started talking to me again, and you know, he said you can have the kids till Sunday. I'm like, whoa, you know. I haven't seen them for almost a year, and we had fun. We went and watched the fireworks here in Yerington, and we were having a barbecue at my dad's, and they started drinking. My family drinks. You know, and I'm fresh out of rehab, and I'm just like, they don't see that. It's hard for them to understand. I know, like, I don't drink anymore, but because I started doing heroin, I'd rather do heroin now. I just wanted to get home, put my kids to bed, and go get high. And that's what I did. I went and got high. I knew I was going to jail. I already talked to the counselor, and you know, I'm high in her office, crying, asking for help. I'm sick of using. And to me, I try to tell myself their mom isn't going to be gone forever. But I feel like the longer I take, the harder it's becoming on them. For them to look at me and say, that's my mom, you know? They gave me that look, like, there's my mom again. I'm back in here. I'm back in here redoing it again, and it gets harder and harder, you know? And when I do think about my kids, I cry. I think about how I can better my life that much more just so I can be in their lives and they can look up to their mother. My soul, my spirit is crying right now for change. Through this whole experience, that's the main person I'm disappointing is myself. I want to put a stop to that right now. I'm going to put a stop to that right now and move forward with my life and fight for my family and get my kids back. It's hard for me to change, but when I do change, it's awesome. Kind of cocoon into something better.
Addiction isn't just getting high, it's surviving. You have to engage in criminal behavior to maintain whatever it is that, you know, that you consider normal.
You have opioid receptors in your body, right? And you take those pain pills, and those pain pills go in and they make you feel good. Your opioid receptors are your feel-good receptors. Well, when you can no longer take those medications any longer, you don't feel good. And when people don't feel good, they will go to great lengths.
I turned one of my sons into a co-conspirator. When I would come to visit, my ex-wife would hide all upstairs because I would probably steal from her if there was anything of value downstairs, and she'd hit everything upstairs, and I was getting dope sick, right? The heroin was wearing off, and I asked my son if he could get me some money, and I had my son go up and take money from his mom.
We need to get people help before they get to the jail. We need to keep people out of jail and get them into treatment.
Going up.
All right, State of Nevada versus Ryan Mills, case number C.
All right.
I loved riding for everything it was. You can travel the world and be at a skate park and have a friend anywhere. Do anything you want through bike riding. Like, that love for BMX is like universal with us. I was 12 when I started riding like skate parks and street riding and dirt jumps. It's what we did every day. I used to be a pro BMXer, I used to ride for premium products, Monster energy drinks, clothing companies, other bike companies. Just used to ride bikes. I broke my wrist riding some dirt jumps. I was trying to ride through the pain, and so I had to take pain pills to go out and ride. I never really wanted to do pills in the beginning. I started to enjoy the feeling of being high from a pain pill. For some reason, I thought it was making me ride better, you know, like not having some sort of fear involved. I think it started off with Percocets or Loratabs, and then eventually went to roxicodone and oxycodone. Just continued to grow from that. I'd use up all my money. Every check I got was to go into pills. And then once that resource ran out, I had to go figure out a way to make money. So I'd find any scam I could. I was stealing a lot from stores. Being around like other addicts, they had, you know, some are more experienced than others, and some will bring up, oh, you're sick, well, I have this heroin. Try this, you'll feel better. And you can hesitate at first, but eventually you'll try it because you don't want to be sick. First time I tried it, I was like, wow, okay, this is like exactly the same thing as pills, but like way more affordable. It turned into basically becoming a full-time heroin addict and no longer even wanting a pill. Eventually, it's like I was shooting up like 8 to 10 times a day, stealing every day, and eventually you're gonna get caught for stealing. So I was going in and out of jail multiple times and getting out and using again, and each time they're like, it's like worse and worse, so you end up staying longer and longer. All my bike riding buddies, my family, just anyone that had a normal life, I didn't feel normal around them, so I disappeared. I was like basically living in squat houses and an abandoned house, and you go live in that. They never really check the closets, so they'll go check the houses, but you could be in here and have all your stuff in there, and no one even knew. I'd be in here for like the night or whatever, or be wandering around the city and come back here with like my stolen goods and whatever drugs I had, get high, go to sleep, wake up, start again. In the deepest of my addiction, I was 130 pounds, had lost some teeth. I overdosed a few times, just like wake up the next day or whatever, being really sick, or like my friends would be like, oh, dude, your lips were blue, you were hardly breathing, you know, it's like that's an OD. So I'm lucky I didn't just pass away. I'm finding out now that, you know, I worried a lot of people, and a lot of people were like, I was waiting for the phone call that you were going to be dead. That feels horrible. And it's like I didn't realize when I was in it that I was affecting people like that. It took me going to jail and then having drug court and sober living and probation to keep me right. And I put myself in a mind state of where I'm not going to have that come back. Like, just like all my willpower is going to, like, this is done. Like, I made drugs my enemy. If I'm in a room with my enemy, I'm either gonna walk away or I'm gonna smash it. I found bike riding again. It's my therapy. I can go to the skate park and it's escape any thoughts I have of like drugs or anything. The love for BMX and like riding and learning tricks, and you know, I can't do everything I used to be able to do, but it's just for fun for me. It's like whatever, I'm going to the skate park to go feel good. I'm real proud of myself, and like my family's real proud of me, and so like it makes me feel like super good inside. Is this happy? That's what it is.
Please, my understanding that the defendant graduated successfully from drug court. Is that correct?
That is correct, Your Honor.
Yes, Your Honor.
Congratulations on completing it. I also want to thank you for completing it, because I do appreciate how much effort it takes. And I thank you, and I know the community thanks you. Again, congratulations, Mr. Mills.
Thank you, I appreciate that.
People do care. You just gotta give them a chance, right? People do care. You gotta give yourself a chance.
You're not alone. Just pick up the phone. Come in. Say something to somebody.
I encourage you not to be afraid or scared.
When you got a hug from him, he just sucked you in. He had these big, giant arms, and he would hug you. Nothing else mattered.
Reach out for help, to ask for help, to make a change if they need it, or if they know somebody who needs help. And that's kind of our message.
If you're struggling from opioid addiction, there's hope for you. There's hope for everyone.
They had the twins for almost 11 months before, I finally got it together. But I can never pay them back for stepping up to the plate and taking them when I couldn't.
In my world, it's about a father with his children and his grandchildren and then his family and having that there. I mean, that's who we are.
Every person's life is worth saving, and those that are struggling with addiction need our love. They need our compassion. They need our understanding.
I want my kids back. I want my family. I want my life. I got a lot to look forward to, and I'm excited for that, so I can do it.
And to take that first step, treatment is available, and you can overcome this.
I didn't realize when I was in it that I was affecting people like that. And now that I'm not high anymore, having their love still and their open arms is like the best feeling in the world, like giving me a second chance. Like I think everyone deserves a second chance. So if you use it right, then you can get everything back.
The state of Nevada is optimistic that together we can change this epidemic and turn the tide. If anyone is out there facing addiction, they need to know that they're not alone, that help is available, and treatment can be very effective. If you or a loved one has concerns and are seeking treatment, go to healthierenv.org. Whatever you do, don't give up. The hope is still there.